We obtained longitudinal blood and tumor biopsy from the PIVOT-2 trial of the melanoma patients. And we use these blood markers and tumor markers to ask questions that we have already identified, that we want to know how Nectar-214 and nivolumab impact the immune system. And we found first that Nectar-214, by harnessing the IL-2 pathway, lead to activation and proliferation of the immune system in the blood. And this activation, rapid activation of the immune system, was noticed all the time after each cycle for a continuous, as long as we treat patients with these drugs. We see these episodes of lymphocytosis, increase in the number of the lymphocytes after a transient episode of lymphopenia, decrease in the number of the lymphocytes, followed immediately by rapid expansion of the T cells after each cycle of Nectar-214. And we've seen similar impact of that in the Nectar-214 monotherapy trial that we performed, the Excel trial with Nectar-214 without nivolumab, indicating that this type of pharmacodynamics on the T cells and the lymphocytes mediated mostly by Nectar-214. And we noticed that when you look at the peak of the lymphocytosis, day 8 after you infuse Nectar-214, you see that these T cells are proliferating. When you evaluate the proliferation by looking at the proliferation marker Ki67, and we notice that the proliferation includes the CD4s and the CD8s and the natural killers. But not only proliferation, when you look at the activation marker, we notice that these proliferating cells also upregulate an activation marker such as ICOS. ICOS has been, especially when it's upregulated in CD4, was noticed in certain published trials that it is associated with positive outcomes. We notice upregulation of ICOS not only in the CD4 T cells but also in the CD8 cells. We also ask questions what type of cells we are leading to proliferation. Is it naive T cells or some of the cells that have seen antigens or could be antigen specific? And we looked at a marker that is well accepted as a surrogate marker for antigen experienced T cells, HLA-DR, and we noticed that the proliferating cells also upregulate HLA-DR, indicating that some of these T cells that benefiting and proliferating and activated from the combination of Nectar-214 and nivolumab can be antigen experienced, which what we want in order to fight cancer properly and attack the cancer tumor microenvironment properly. You want those antigen-specific T cells to benefit from Nectar-214 and nivolumab. And certainly looking at the HLA-DR, it's a surrogate marker for antigen-experienced T cells. When we look into the tumor microenvironment, and that's very important, as my boss always say, the tissue is the issue. So when looking at the tumors, we notice that there is increase of the T cells on treatment after you treat them with Nectar-214 and nivolumab. So we assess that a number by looking at by doing two different assays. One of them is multiplex immune fluorescence, and we looked at different markers, and we saw that CD8 and CD3 cells are increased after when you take a biopsy 3 weeks after you start the treatment. There are other markers were upregulated in the immune fluorescence, such as PD1, CD68, but what we noticed also with an increase of the CD3s and CD8s in the tumor microenvironment, and some of the patients we noticed decrease in the melanoma markers. That's what we looked at, the SOX10 marker, which is a tumor-associated antigens, and we noticed that when we see increase of the CD8 cells, we notice in some patients decrease in the marker, which means that the increase of the T cells was associated also maybe with decrease of the tumor burden. We verified this with looking at the traditional immunohistochemistry, and we also seen that majority of the patients had increase of their T cells after they're receiving the treatment. So we really verified the increase of T cells in the tumor microenvironment in multiple assays.